Well, so much for full speed ahead in reopening the U.S. economy. Multiple states, I know some of you have already heard this, but from Texas to Florida to California are now forced to retrench and impose or reimpose partial lockdowns as we watch the coronavirus, simply refuse to go back from whence it came. In fact, it's rearing its ugly and deadly head in Florida and North Carolina more viciously than it ever did in New York City. For those of you who watch the Claman Countdown, my 3 p.m. Eastern show on Fox Business, you know that back in January, I remember the exact day, January 21st, as some were calling the virus a hoax, Countdown was the first business network show to call in global infectious disease experts because we took it seriously. What made me different from other journalists? My sister-in-law, Dr. RImoin, is a world-renowned epidemiologist who for years has been giving a speech entitled Global Pandemics and How to Stop Them. But can we stop this one? Dr. RImoin, I know her as Annie, is taking time out from battling it all from the front lines to hopefully answer that question and more. Welcome to Everyone Talks to Liz, Annie. Thanks for coming on.
Oh, it's such a pleasure to be here.
So I know you have been crazed since early January, but what has the last 48 hours been like for somebody like you who is constantly on the phone with global experts, you as an expert they are turning to as well?
Well, it's been more of the same that we've had over the last several months. We are in the grips of a pandemic, and I think that for those of us who are working on trying to stem the tide and working on studies related to COVID, the news of the last 48 hours of us moving to the point of starting to shut things down again is really just a sense of relief, because we've all been watching this coming. I mean, this is not something that nobody predicted. In fact, we all predicted that we would be, if we were not careful, if we did not have mandatory mask laws in place, if we did not have teeth to our recommendations, and if everybody didn't do their part, we would be right where we are. So there is nothing surprising about where we are right now.
My viewers noticed that 2 weeks ago, I suddenly disappeared from the air, and I thought that I would explain to them what had happened because it is directly and indirectly involved in this. I had a family emergency out in LA. My mom got a little ill and she's okay now, but I had to rush to Los Angeles. Now, traveling was daunting, but I picked up the phone and I called you and I said, can I come? Am I risking my life? And you said you won't be if you do the following: goggles, gloves, double mask, bring your own soap on the plane, bring your own hand sanitizer on the plane, bring your own food, don't look at anybody, don't talk to anybody. And I followed to a T. What is happening with travel? I'll tell you what happened, everybody, when I landed, but let's talk about travel. Can people travel?
Well, listen, there is no activity that you can do today that is without risk, and unless you're going to stay home. And for those people who don't have to go somewhere, they should stay home, because we are in the midst of a massive escalation in most places in the country. So, if you do have to fly, and many of us do for many reasons,
Right.
Just like you coming home to LA, that you have to be very careful about your surroundings, and you can't always control your surroundings on when you're going into airports, when you're going onto an airplane. You are subject to the exposure of and everybody else's risk around you. So it's exactly as I said. You should be wearing a mask, of course. You should be wearing some sort of protective eyewear, if possible, like goggles.
Mhm.
Can't wear goggles, wear a face shield. Bring hand sanitizer, bring your own soap, bring your own towels if you can. Bring everything that you can that can help you avoid having any kind of contact with common touch surfaces. If you're going to be on a cross-country flight or an international flight or any flight where you're there for more than an hour or so, you're probably going to have to use the restroom. And so you have to kind of game it in your head how you're going to do this. And that includes thinking through, okay, how am I going to touch the doorknob? How am I going to wash my hands? What can I avoid touching that's a common touch surface?
Which is exactly what I did. I followed your advice to a T, but upon landing at LAX, I still didn't know. Did I dodge it? And you had ordered me to wait a couple of days and then get tested, because it takes a while for the little dastardly microbes to move around and start showing their faces.
Mm-hmm.
So I maintained major social distance from my mom. I double masked. And 3 days in, I went to get a same day result test with the swab. And I will tell everybody, I'm a baby, okay, but I'm not the worst. I was not happy with this swab test. It was jammed all the way up my nose. I mean, I was, but just as I thought, I can't take it anymore, it was over. And happily, I turned out negative. And that's when I could at least get a little bit closer to my mom. However, during that time, Annie, as you know, Governor Cuomo of New York State put California back on the list of gotta quarantine if you've been there and you're coming back to New York.
Mm-hmm.
So I got back and I had to take another test. I mean, this was 2 tests within 4.5 days. I was negative, thankfully. I got it at NYU Tisch Langone, thanks to Dr. Mark Siegel, who of course is the Fox doctor. But I can tell you, I felt better, but it's almost like a day later, I could be positive if I happen to step in the wrong place, correct?
That is absolutely right. The problem with testing is it tells you about your exposure for the past 2 weeks. It doesn't tell you about your current status, of today. And the probability of testing negative for the first week after being exposed is actually testing negative if you actually are positive for the virus is very high. So, for example, the first day that you're exposed, if you get a test, you are 100% likely to test negative, even though you were infected. And every day, those odds go down a little bit. So the probability after one day is about 88%, and then it goes down to about 67%, and somewhere around day 6, it starts to become more likely that you would test positive rather than negative if you are infected. But it's really only between around day 7 that you have only a 20% chance of testing negative if you are positive. And so there's no test that's perfect right now. I mean, the testing right now is such a difficult situation. Everybody is doing the very best that they can, but the tests are not perfect. They're just not.
So I want our viewers and listeners to understand about you. You're an internationally recognized expert on Ebola. You have spent the last how many years? 20 years going to and from the Congo.
Democratic Republic of the Congo. Yep.
How many times have you been back and forth?
Oh my gosh, it would be impossible to, I mean, I go back and forth 4 to 5 times a year, and I've done so for the past 20 years.
Okay.
To DRC, but I worked all over Africa prior to that, and was a Peace Corps volunteer in West Africa, and so I spent my whole career working in sub-Saharan Africa.
I remember when my brother met you, because your parents lived across the street. Your stepmom and your father lived across the street from my parents. My dad died. My dad was a brilliant Canadian-born surgeon. Your dad, Dr. David RImoin, was a brilliant Canadian-born geneticist, rather, who discovered type 2 diabetes, correct? And was an expert in dwarfism, just a genius in genetics. And he died, so my mom hosted your stepmother, and you came along, and my brother happened to come along, and you met. And he called me up and he said, Liz, she is a tenured professor at UCLA, epidemiologist, PhD. She's amazing. And she knows all about Ebola. And I'm thinking, great, that's really, really exciting. But it was because we looked at you and thought, oh my God, you are so gutsy. You are known as the virus hunter. What possessed you to say, I want to go to the Congo and I want to hunt down this virus, Ebola, that liquefies your insides and kills you instantly, basically? I mean, how did Annie become Dr. Anne RImoin?
Well, I mean, it was not evident for me. I grew up, I mean, I didn't grow up in that house across the street. I grew up in Palos Verdes, and I actually was far from being a scientist. I was a cheerleader in high school. I was I went to Middlebury College. My undergrad degree was actually African history, and my minor was music. I was a musician. I literally, my dad being this really world famous medical geneticist, I was terrified of science, and so he always used to say, Annie avoided science like the plague, and then she became scientist that studies plagues, and so that's actually really true. But it was because I ended up going into the Peace Corps, and it was when I graduated from college, I applied to the Peace Corps. Not really sure what I was going to do, thinking that I was probably going to go to law school or do something. I was, interested in music, entertainment industry, things that had nothing to do with science. And because I was fluent in French, I got put in this perfect public health program, the guinea worm eradication program. And they literally put me in Benin, West Africa, seconded me to UNICEF, and gave me a motorcycle and taught me to do disease surveillance in West Africa. And with this perfect public health program, the guinea worm eradication program, which is a waterborne disease that is on the verge of eradication. And so I just was put in this perfect program, and I just realized how important public health was and how achievable public health was, and that it was just something that you could have great impact. And so I got my master's in public health at UCLA, and then I worked for a variety of different organizations, including World Health Organization for a few years, doing polio eradication, and then I went and got my PhD at Johns Hopkins. And so it was just this path, moving closer and closer to working in infectious diseases, and I became fascinated with emerging disease. And my undergraduate degree being African history, and my thesis was on the Congo crisis and what was known as Zaire. And so when I got a job at NIH, when I finished my PhD, they offered me a job and said, listen, there's going to be this project in the Democratic Republic of the Congo. This was in 2002. And they thought I would run out the door screaming, saying the Congo, but it had been the country that I had been always interested in. My dissertation had been on the Congo. And so I said, sure, I'm in, let's do it. And so I went to Congo, and it was a really fantastic country that needed so much help. And I just felt like it was something I could do. And so I kind of jumped in and did it, and met people there who were just inspirational and incredible. And I saw the need, first starting with monkeypox being a very understudied illness that nobody really understood. It's related to smallpox. And we started learning that there were a lot more cases than anticipated. And then, started looking at all these other zoonotic diseases, and then we started seeing more and more cases of Ebola. So I got roped into to applying what we already knew about Congo and disease surveillance to Ebola, and that's where I really started working on Ebola.
Ebola is terrifying to me. I read all the books on it because I was always interested in this stuff from a distance, please. And as I studied it, it just seemed like you couldn't fight it. And yet you have. You and your team in the Congo have figured out how to shut it down fast when it pops up. Why is it so hard to shut down the coronavirus in the most developed country in the world, America?
So, it's a really good question, but it's a very different type of virus. So Ebola is a virus that is spread from bodily fluids, and you need to be in much more direct contact with those fluids. It's not respiratory. So the problem with coronavirus is it is a respiratory virus that is spread from respiratory droplets, and as we've learned, very recently, it also has a potential to be able to be aerosolized and hang out in the air for a period of time, which makes it extremely difficult to control. Diseases that require more direct contact are much easier to control than something like a coronavirus. Coronavirus just has a it's the problem is that so many people are asymptomatic. So many people are also pre-symptomatic. So they are very, very infectious a few days before they start to show symptoms. And so it's very difficult to be able to control a disease where half the people don't even know they have it and never know they have it, so they can't do anything about it. Or just a few days before they are symptomatic, and so they still don't know they have it, they're out and spreading it to other people. It makes it extremely complicated. Ebola, most cases are acute, and if you are, we don't think that people who may have some sort of mild or asymptomatic infection are very infectious. So that's a very big difference. And that's what makes just coronavirus so insidious and so difficult to be able to fight.
You're listening to Everyone Talks to Liz with epidemiologist Dr. RImoin. We will be right back. You've been giving a speech called Global Pandemics, How to Stop a Pandemic Before It Starts. Is that the right title? I remember you giving the speech years ago.
Preventing pandemics before they start. Yeah, that's
right.
The easiest way to do it, is prevent them before they start, as we are learning the hard way right now.
And suddenly it happens and nobody was listening. I mean, except maybe Bill Gates and your colleagues around the world. But this has been a disaster. It truly has. But we're not the only country. It has. I mean, I can remember, so in January, on the 20th, I think, or the 21st, IMAX, this is what got me onto it. IMAX announced it was going to hold off on rolling out its Chinese New Year slate of films in China because they had shut down the theaters. And I said, oh, well, let's look at gold, because gold is a great global indicator. I'm always a thinking business. Global indicators, gold and treasuries show a flight to quality, and gold was moving. It was moving up. And I thought, oh, we got to do this story. So I told my team to reach out to, my sister, Dr. RImoin, and if she's not available, Laurie Garrett, who wrote The Coming Plague. She's a Pulitzer Prize-winning journalist. Brilliant. You know her. She's a friend of yours. I introduced you guys. I made a little Yenta thing with you two.
You sure did.
And Laurie couldn't do it that day. And then my team said, Annie can, but do you want to wait till tomorrow? Because I was off for some reason. And I said, I would, because I want to be the one to interview her. But to me, there was like this spidey sense. I said, we got to get her on the air today. It felt like minutes mattered. And so my fill-in, Ashley Webster, interviewed you back then, and there was so little known about it. The cruise ship thing hadn't happened. It hadn't arrived in America yet, as far as we knew. And you came on, and you had to be honest. You said, there's a lot we don't know, but we got to watch this thing carefully. And then it kind of spun out of control, didn't it?
It sure did. I don't think that any of us anticipated that we would be where we are right now. There are so many. It's always easy to look back and say, well, I wish we had done this and I wish we had done that. But nobody anticipated the total and complete lack of leadership and failure of our public health system because of years of underfunding and lack of resource and lack of foresight, and the fact that we just don't have good leadership to be able to pull us out of this. I mean, that's what you see in countries that have really been able to be able to do what they need to do.
How do we get to this point where it is now this weird political divide? You have Los Angeles and San Diego saying, we can't open our schools in the fall. We don't know enough about how children get it or how it's transmitted. And then Orange County, which leans right, leans conservative, says in the last 48 hours or so, you tell me what Orange County said. This is stunning to me.
Orange County Board of Education voted for kids to return to classes in fall without requiring social distancing or masks. I mean, it's shocking. I mean, and this is a perfect example. We're not even talking about, well, we have different states, and if one state is doing poorly or not following best practices, then another state is impacted. I mean, we have the county next door to us in direct opposition to what Los Angeles County is planning on doing and San Diego County is doing, and with a virus that is so contagious and spreads so easily, anything that happens right next to you impacts you.
Well, but again, and I'm not a political person, but I am completely perplexed by how this has somehow come down on red and blue lines. I've interviewed Governor Pete Ricketts of Nebraska multiple times. He is a super smart guy. He's amazing. I love him. He's Republican. And suddenly he announces in June, he tells local officials they cannot require face masks if they want federal coronavirus relief funding. What? Are you kidding me? Nebraska, which has this massive outbreak in some of their food processing plants, it's almost like for so long, President Trump, who just now donned a mask recently, had questioned it as some sort of political diss to him, and Republicans fell in line. Governor DeSantis, people didn't want to do it, and now the Texas governor, Republican, tried and true, Governor Greg Abbott, sees what's happening in Texas, and he's requiring masks now. And you're going to take on Governor Abbott. He is a smart as a whip guy, and he looked at this and said, "Knock it off. We got to wear masks."
Well, I couldn't agree with you more. There's a great lead line in an op-ed by John Barry, who wrote The Great Influenza. And he said, when you mix science and politics, you get politics. And with coronavirus, the United States has proved that politics hasn't worked. And I think that that's just a perfect way of saying it. I mean, I've been saying over and over again, when you have mixed messages, politics fills the void. And that's exactly what's been going on here. I mean, the fact that masks are political is just insanity. It just doesn't make any sense. I mean, it's just a very basic public health measure. It's like saying washing your hands is political. I mean, it doesn't make any sense. It's ridiculous.
Oliver Stone, the famed director, some love him, some hate him. He's rewritten a lot of history in some of his movies, which is fine. It's Hollywood. He has just come out in a New York Times interview and thrown shade at people like you, quite frankly, when it comes to trying to stem the virus, and specifically about Hollywood. He said, and I quote, "Everything has become too fragile, too sensitive. Hollywood now, you can't make a film without a COVID advisor." Well, how are you going to do a kissing scene, Oliver, without an epidemiologist at least advising how to do it safely, right?
It sounds like Oliver Stone has gotten a little bit too sensitive about what needs to be done. And I promise Oliver Stone I won't try and make a movie if he tries not to be an epidemiologist. So
what is with all these armchair epidemiologists?
I mean, I just think I think that people need to let the science speak, and it means the full science. And we know that it is very difficult to be able to contain a virus that is airborne. The fastest road to recovery is to just beat the heck out of the coronavirus. That is literally the only way out. And so for everybody who is upset about wearing a mask or upset about having to, stay home and not go to the gym or go, someplace where, we all want to go out. I want to go to a restaurant. I want to go on vacation. I want to do all of these things, but it is not prudent. And the only way for us to get out of where we are now is to just crush the epidemic curve. Because if we could do that, we could start getting back to normal. Sure, everybody might have to wear a mask, but schools could open, restaurants could open, Disneyland could open.
Mhm.
But right now we are seeing escalating numbers of cases of COVID, and it has no sign of slowing right now.
Any
Um,
sign, any sign of a vaccine?
well, today there was an interesting announcement from Moderna that everybody in their trial showed um, at least some sort of immune response, which is encouraging.
Mm.
We still don't really know what it means and how how this will play out on a large scale. But that's good news. That's definitely encouraging. But I just want to be really clear here. There is no magic bullet. And even if we end up with a vaccine that's going to be helpful to us, it will take time to be able to get it out to people. And just having good news about a vaccine is not going to be a game changer. When we start seeing vaccine that is widely available to people and distributed
Yeah.
over large swaths of the population, then we're going to be able to start having a little bit of normalcy. But until then, our best bets are wearing a mask, social distancing, hand hygiene, all the really, old school stuff that we talk about, all the things that worked in the 1918 flu pandemic. I mean,
Yes.
that is where we are right now.
I have to ask about you again because I have seen video, I've seen pictures of you schlepping through the jungle in the Congo, no roads, and you're vaccinating little kids and you're taking blood from survivors of the most frighteningly named things like chikungunya and yes, guinea worm. Oi, don't even. Have you, what diseases have you caught in your travels and in your work? What have you recovered from?
I've been very lucky to date. I actually have had what we thought was malaria once.
Mhm.
Um, and it was because I was out in the field doing a study and got stuck there for several weeks where I didn't have enough malaria meds. So it made perfect sense that I would have gotten malaria.
Mhm.
But aside from that, just a little bit of, standard GI trouble like anybody else. And I have not gotten sick. I just haven't. I
Were you
really,
ever worried about getting Ebola?
of course, everybody is always worried, but you do the things that work. And the things that work are following public health guidelines and making sure you follow them religiously. It's when you get tired and you get sloppy that sometimes you can run into problems. But
Mhm.
but the fact of the matter is that we know a lot about how to combat disease and to really slow down disease transmission. We've done it with Ebola. We've done it with many diseases. There are many diseases where we do have vaccines, and so that makes it much easier. But I'm really good at making sure I do the things that we're supposed to do, and you know try
Mm.
to as I think your dad might have said, it's much easier to stay out of trouble than to get out of trouble.
Boy, isn't that the truth? Let's stay out of trouble. And I want to finish with this because I know that you know so many um, doctors and nurses and frontline hospital workers. Have you known anybody who died from COVID yet?
I've been lucky enough to date not to be very close to anybody who's died from COVID. But
Mhm.
I am running the study here at UCLA on asymptomatic infection and immunity in healthcare workers and first responders for COVID. And we started this study really early on at the very beginning, actually, just based on the fact that I had been doing surveillance in healthcare workers in Congo and around the world for so long. I mean, they're such an important group to protect and to monitor for disease. And so I, along with my colleagues at UCLA, we were able to get this project started. And in the early days, we really didn't see a lot of cases because PPE works, wearing masks work, hand hygiene works, and California shut down quickly, and we really did not see a lot of cases. But over time, as society has opened up, of course, now we're starting to see cases in these populations. And so that's why it's really important to be thinking about these studies and doing them. You gotta, it's Wayne Gretzky. You gotta go where you think the puck's gonna go, not where it is now.
Right. From high school cheerleader to virus hunter, I am so lucky to have you be a member of my family. And the world is lucky to have you hunting and fighting these viruses. And we can't thank all of our hospital caregivers and our experts like you enough. Annie, thank you so much.
Oh, it's my pleasure. Thanks for having me.
My sister-in-law, Dr. RImoin, epidemiologist, UCLA, helping the world. Please listen to this advice. Forget about the colors, red and blue, political, who you support for president. Live your life. And just as the famous Dr. Mo Claman once said, it's easier to stay out of trouble than to get out of trouble. So mask it, people, or the redhead's going to get upset. Thank you so much once again for listening to Everyone Talks to Liz. I'll see you Monday through Friday, 3 p.m. Eastern on the Claman Countdown, Fox Business. I appreciate you listening, guys. For the rest of this podcast and for more podcasts like this, go to foxnewspodcasts.com.